Hi everybody, my name is Paige Coulter and I am the Director of Nursing at the Crisis Pregnancy Center of Tidewater, also called CPC for short. I'm a registered nurse and I have been a nurse for about 9 years now. I have been working here at CPC for about 3 years. And I chose the career of nursing honestly because when I was younger, my grandma is one of my biggest influences and one of my biggest role models, and I wanted to be just like her. So I decided that I should pick the same profession if I wanted to be like her, and she's a retired nurse, so that's why I chose nursing. A typical day in my profession, this is a pregnancy clinic where I work. So I help women. I do pregnancy tests and ultrasounds for them. Also provide a lot of education and resources and referrals to help women and to help them have a healthy pregnancy and just to get prepared to have a baby. So how old was I when I first started working towards this? In high school, I chose certain courses like AP Bio that I knew would help me down the road with nursing school and college and everything. So I would say about 16 when I decided like that was the direction I wanted to go and when I wanted to pursue. So that helped. And that helped me eventually get into nursing school as well. So I did 2 years of general education classes in college, and then I applied for nursing school, got into that, and did another 2 years to get my nursing degree. During that time in nursing school, we do a lot of what we call clinical hours too, where we work alongside nurses in a hospital setting and just kind of learning the ropes and learning how to do certain nursing tasks and how to be a nurse. So what are some traits or skills that would make someone successful in nursing? I would say compassion, definitely. You have to care about people to want to take care of them. It's a lot of hard work and you're taking care of other people physically, and just compassion is a huge trait that you would have to have. Also attention to detail. When you're dealing with medications and orders from the doctors, you definitely need to be able to pay attention to detail in order to take care of your patients well. Also being a team player. Nursing is definitely part of a team. You work with other nurses and other support staff, and then doctors, of course, as well. So you definitely want to be a good team player, be able to take orders, and also be able to work well with other people. The favorite thing about my career is helping people, especially where I work right now. I get to serve women and help them and their families. A lot of them are just finding out they're pregnant, so they're a little scared, a little nervous, so I get to help them and help get them prepared to have a baby and just to get excited about having a baby. So some challenges that people encounter in nursing, especially more in the hospital settings, there's heavy workloads, so sometimes there can be burnout, so just having that expectation to be able to take care of a lot of people with maybe not a lot of time or a lot of resources, so that could be a challenge. Also, depending on where you work, there could be the potential for some sad situations. People pass away sometimes when you're trying to take care of them. They could be very sick. Obviously, if someone has cancer or some of those terminal illnesses, that can be challenging to take care of people like that and working with their families, so that can definitely be tough. So how much can someone expect to make in your career? Nursing is really diverse, so there's all kinds of jobs and roles that nurses can have. It's not just working in a hospital or doctor's office, so because of that, that is something that I love, that you could do anything with nursing. But because there's so many different types of nursing jobs, then the pay can vary a lot. So I was trying to look up kind of nationally some averages, but from what I could see, it can be anywhere between $50,000 and $100,000 a year. Remembering that a lot of nurses that work in the hospital setting do a lot of weekends and night shifts and holidays and overtime, so there's a potential to make a lot of money, but it's a lot of hard work too, and a lot of time and different shifts at the hospital, and obviously working on holidays and stuff, which a lot of careers you don't have to do that, but with nursing I always say sick people don't just get better because it's Christmas, so they're still in the hospital and they still need to be taken care of. So that's something to remember. So I hope this was helpful, and thanks for watching.